Is it anxiety or a heart problem? How to tell the difference? It is a terrifying and deeply confusing experience, one that happens to millions of people every year. Your heart begins to pound in your chest, seemingly out of nowhere, beating so fast and hard you can feel it in your throat. Your breathing becomes shallow and rapid, as if you cannot get enough air into your lungs. A strange pain or tightness spreads across your chest, and a wave of dizziness makes you feel like the room is tilting and you might faint. In that moment of pure physical and emotional chaos, two frightening questions flash through your mind. Am I having a panic attack, or am I having a heart attack? This confusion is incredibly common, and for a very good reason. The physical symptoms of a severe anxiety or panic attack can mimic the symptoms of a serious heart problem with stunning accuracy. This uncanny overlap creates a vicious cycle of fear. A person might experience a panic attack, mistake the intense physical sensations for a heart attack, and the resulting terror can amplify the adrenaline surge, making the panic attack even worse. Conversely, and more dangerously, a person experiencing a true cardiac event might have a history of anxiety and dismiss the symptoms as just another panic attack, a potentially tragic mistake that can delay life-saving medical care. The purpose of this article is to bring clarity to this confusing and frightening topic. We will explore the reasons why these two very different conditions can feel so similar, delving into the shared biological response that links them. We will then carefully dissect the key symptoms, highlighting the subtle but important clues in the character, timing, and context of your experience that can help you distinguish between them. It is crucial to understand that this guide is for educational purposes and is not a substitute for a professional medical evaluation. The most important rule is always this: when in doubt, get it checked out. However, arming yourself with knowledge can help you reduce unnecessary fear, have a more informed conversation with your doctor, and ultimately allow you to take better care of both your mental and your physical heart. The great overlap: why anxiety feels like a heart attack. To understand how to tell the difference, we must first understand why the symptoms overlap so profoundly. The answer lies in your body's ancient and powerful fight-or-flight response. This is your body's emergency alert system, a hardwired survival mechanism designed to prepare you to face a perceived threat with maximum physical capability. When your brain perceives danger, whether it is a real physical threat like a speeding car or a psychological threat like a stressful work presentation, it triggers the release of a surge of stress hormones, most notably adrenaline. This flood of adrenaline is designed to give you a burst of energy and focus to survive. It does this by causing a series of dramatic, instantaneous changes in your body. Your heart rate and blood pressure increase to pump blood to your muscles more quickly. Your breathing becomes rapid and shallow to take in more oxygen. Your muscles tense up, ready for action. You might start to sweat to cool your body down in anticipation of physical exertion. Now consider what happens during a heart attack. The heart muscle is being starved of oxygen, which is a true life-threatening emergency. Your body's fight-or-flight system goes into overdrive, releasing that same massive surge of adrenaline to try to force the heart to keep working and to signal that something is catastrophically wrong. This is the great overlap. A panic attack is in essence a fight-or-flight response that has been triggered in the absence of a true physical danger. It is a false alarm. A heart attack is a true physical danger that also triggers the fight-or-flight response. Because the underlying hormonal and nervous system response is the same, the physical sensations they produce, a racing heart, shortness of breath, sweating, and chest tightness, can feel virtually identical. Decoding the chest pain, the most important clue. Chest pain is often the most alarming symptom, and the one that causes the most confusion. While there is no foolproof way to distinguish between the two without a medical evaluation, the character of the pain, meaning how it feels, where it is, and how it behaves, is often a very important clue. Learning to pay attention to these details can provide valuable information that can help you and your medical team understand what is happening. The character of cardiac chest pain. The pain of a heart attack, known as angina, is typically caused by a lack of blood flow and oxygen to the heart muscle. Because of this, it is often described not as a sharp, superficial pain, but as a deep, visceral feeling of intense pressure, squeezing, tightness, or fullness in the center of the chest. Many people describe it as feeling like an elephant is sitting on my chest, or a tight band is being squeezed around me. It is a heavy and oppressive sensation that feels like it is coming from deep within your body, not just on the surface. It can also be described as a burning sensation, similar to severe heartburn, which adds to the confusion. Another key feature is that this pain tends to be diffuse, meaning it is hard to point to the exact spot with one finger. If you were asked to locate the pain, you would likely use your whole palm or a clenched fist to indicate the general area in the center of your chest. Critically, cardiac pain often radiates or travels from the chest to other areas. It commonly moves to the left arm, but it can also radiate to both arms, the shoulders, the neck, the jaw, or the upper back, particularly between the shoulder blades. This radiation happens because the nerves from the heart share pathways with nerves from these other body parts, and the brain gets confused about the pain's origin. The pain is also typically persistent. It does not usually go away in a few seconds. It lasts for several minutes and may come and go in waves. Finally, it is often brought on or made worse by physical exertion, like climbing stairs or carrying groceries, and is relieved by rest. This is a classic sign that the heart is not getting the blood it needs when demand increases. The character of anxiety-related chest pain. Chest pain associated with anxiety or a panic attack, on the other hand, often has a very different character. It is frequently described as a sharp, stabbing or shooting pain, rather than a dull, heavy pressure. This type of pain is often caused by intense muscle tension in the chest wall or spasms of the small muscles between the ribs, which are common during a high anxiety state. The adrenaline surge can cause you to unconsciously tense your entire upper body, leading to this sharp muscular pain. This pain is often localized, meaning you can point to the exact spot where it hurts, and it may feel closer to the surface. It does not typically radiate to other parts of the body in the same way that cardiac pain does. Anxiety-related chest pain is also often fleeting. It may come as a sharp jab that lasts for only a few seconds and then disappears, or it may come and go erratically. It is often related to your breathing and may feel worse when you take a deep breath or press on the area. This is a key non-cardiac sign. If you can make the pain worse by pushing on your chest, it is much more likely to be muscular in origin. Unlike cardiac pain, it is not typically brought on by physical exertion. In fact, sometimes light physical activity, like walking around and stretching, can actually help to relieve the muscle tension that is causing the pain. The story of your breath. Analyzing shortness of breath. Shortness of breath is another symptom that causes significant overlap and fear. It is a terrifying sensation, regardless of its cause. Again, paying close attention to the specific quality of the sensation can provide important clues to its origin. Cardiac shortness of breath. When shortness of breath is caused by a heart problem, it is often a true air hunger. It is a physical inability to get enough oxygen because the heart is not pumping blood efficiently. This inefficiency can cause blood to back up into the lungs, a condition that can lead to fluid accumulation. This type of shortness of breath typically gets worse with physical activity. You might feel fine while sitting down, but become profoundly breathless after walking up a single flight of stairs. It can also be worse when you are lying down flat, a condition known as orthopnea, and may improve when you sit up, as this allows gravity to help pull the fluid down in your lungs. This is a significant red flag for a cardiac issue. It is a mechanical problem. Your lungs are working, but your heart cannot keep up with the circulation. Anxiety-related shortness of breath. Shortness of breath during a panic attack is usually a result of hyperventilation. The fight-or-flight response makes you breathe very rapidly and shallowly. This rapid breathing blows off too much carbon dioxide from your blood, which can paradoxically make you feel like you are not getting enough air. The sensation is often described as feeling like you cannot get a deep, satisfying breath, or cannot fill your lungs all the way. It can feel like you are suffocating, even though you are breathing very quickly. Unlike cardiac shortness of breath, it is not typically related to physical exertion and can happen while you are completely at rest. It is often accompanied by other signs of hyperventilation, such as tingling in your hands, feet, or around your mouth, and a feeling of lightheadedness, which are caused by the chemical changes in your blood from overbreathing. Context is key. Triggers, timing, and associated symptoms. Beyond the character of the specific symptoms, the broader context in which they occur can provide some of the most valuable clues. Taking a step back to look at the whole picture can often help to clarify the situation. Triggers and onset. A heart attack is often, though not always, triggered by physical exertion or extreme emotional stress. A panic attack, on the other hand, can be triggered by a specific phobia, a stressful situation, or it can seem to come completely out of the blue, even waking you from sleep. Timing and duration. This is a critical distinction. A classic panic attack tends to have a rapid onset, with symptoms building to a crescendo and peaking in intensity within about 10 minutes. The entire episode, while feeling like an eternity, usually subsides within 20 to 30 minutes, leaving you feeling exhausted and shaky. The symptoms of a heart attack, however, are typically more persistent. The chest discomfort may last for many minutes and can come and go in waves over a longer period. It does not typically have the same rapid peak and decline as a panic attack. Other associated symptoms. While there is overlap, some symptoms are more strongly associated with one condition than the other. Nausea, vomiting, and pain that radiates to the jaw or arm are more classic signs of a heart attack. A feeling of unreality or detachment from your body, a fear of going crazy or losing control, and tingling sensations in your extremities are classic hallmarks of a panic attack. A sense of impending doom can occur with both, but in a panic attack, it is often accompanied by a fear of losing your mind. whereas in a heart attack, it is more often a physical sense that something is catastrophically wrong with your body. The importance of your personal risk profile. One of the most important factors to consider when interpreting your symptoms is your own personal risk profile for heart disease. Your symptoms do not occur in a vacuum. They occur within the context of your unique health history. A healthy 25-year-old with no family history of heart disease, who experiences chest pain during a stressful exam, is far more likely to be having a panic attack. An overweight 60-year-old with high blood pressure, diabetes, and a history of smoking, who experiences chest pressure while mowing the lawn, is at a much higher risk for a true cardiac event. Understanding your risk factors is not about creating fear. It is about promoting awareness and helping you make more informed decisions. Let us look at these major risk factors in more detail. Older age. This is the most significant non-modifiable risk factor. As we age, our arteries naturally tend to become stiffer and more prone to the buildup of plaque. The cumulative effect of minor lifestyle insults over many decades begins to add up. For women, the risk accelerates dramatically after menopause due to the loss of the protective hormone estrogen. A family history of early heart disease. This is a powerful clue that you may have a genetic predisposition to heart problems. If a close male relative, such as your father or brother, had a heart attack before the age of 55, or a close female relative, like your mother or sister, had one before the age of 65, your own risk is significantly higher. This could mean you have inherited genes that make you more susceptible to high cholesterol, high blood pressure, or the process of plaque formation itself. High blood pressure, often called the silent killer, high blood pressure puts constant, excessive force on the delicate inner lining of your arteries. Imagine a garden hose with the water turned on too high all the time. This relentless pressure causes microscopic tears and damage to the artery walls, creating rough spots where cholesterol can easily get stuck and begin to form plaque. High cholesterol, specifically, high levels of low-density lipoprotein cholesterol, the bad cholesterol, are a major problem. Think of this cholesterol as the raw material for plaque. When you have too much of it circulating in your blood, it is more likely to infiltrate the damaged areas of your artery walls, fueling the growth of the blockages that can lead to a heart attack. Diabetes, or prediabetes. High blood sugar is incredibly damaging to your blood vessels. Sugar molecules can attach to the proteins in your artery walls, making them stiff, sticky, and inflamed. This is why having diabetes is considered a risk equivalent, meaning that a person with diabetes has the same risk of having a heart attack as someone who has already had one. Smoking. This is one of the most significant and damaging risk factors you can control. The thousands of chemicals in cigarette smoke are directly toxic to the inner lining of your arteries. Smoking causes immediate inflammation, makes your blood stickier and more prone to clotting, and constricts your blood vessels, forcing your heart to work harder. A sedentary lifestyle. Your heart is a muscle, and like any muscle, it benefits from regular exercise. A lack of physical activity contributes to a weaker heart, and it is also a major driver of other risk factors, including high blood pressure, obesity, and poor blood sugar control. Obesity, carrying excess weight, particularly visceral fat around your abdomen, is a major risk factor. This type of fat is not just a passive storage depot. It is a metabolically active organ that releases inflammatory chemicals that travel throughout your body, promoting inflammation in your arteries and contributing to insulin resistance. The more of these risk factors you have, the more seriously you should take any new chest symptoms. Your personal risk profile is the lens through which you must view your physical sensations. When to stop guessing and seek help immediately. While understanding these differences can be helpful, it is vital to remember that they are just general guidelines. There are always exceptions, and the symptoms of a heart attack, particularly in women, can be highly variable and may not follow the classic patterns. Because the stakes are so high, the most important rule is to err on the side of caution. You should call for emergency medical help immediately if you experience any of the following. A new unexplained chest pain or pressure that is severe, persistent, or worsening. Do not wait for it to become unbearable. If the discomfort is strong enough to make you stop what you are doing and wonder what is happening, that is a signal to act. Chest discomfort that is accompanied by pain radiating to your arm, neck, jaw, or back. This is a major red flag. The spread of the pain indicates that the signal is strong and likely originating from a significant issue like the heart. Shortness of breath that is severe or occurs with minimal exertion. If you are suddenly breathless doing something that is normally easy for you, that is a warning sign. This is especially true if it happens while you are at rest. Chest discomfort that is accompanied by sweating, nausea, or severe dizziness. This combination of symptoms is highly suspicious for a cardiac event. The body is reacting to a major crisis, and these associated symptoms are part of that systemic alarm. It is always better to go to the emergency room and be told that it was just a panic attack than it is to stay at home and risk permanent damage to your heart muscle. Do not worry about being embarrassed or bothering the medical staff. Their job is to help you, and they would much rather evaluate a false alarm than have you wait too long with a real emergency. Time is muscle when it comes to the heart, and every minute that a blockage persists, more heart tissue is dying. Acting quickly is the single most important thing you can do to ensure a better outcome. Conclusion: partnering with your doctor for a clear diagnosis. The fear and uncertainty caused by the overlap between anxiety and heart symptoms can be debilitating. The ultimate goal is to move from a place of fear to a place of clarity, and that can only be achieved by partnering with your doctor.
If you are experiencing these types of symptoms, it is essential to get a thorough medical evaluation to rule out any underlying heart problems. This may involve an electrocardiogram to check your heart's electrical activity, blood tests to look for signs of heart muscle damage, or a stress test to see how your heart performs under exertion. If a heart problem is ruled out, it does not mean that your symptoms are not real. It means that they are likely being caused by anxiety, which is a very real and treatable medical condition. Working with a therapist or counselor can provide you with the tools, such as cognitive behavioral therapy and relaxation techniques, to manage your anxiety and reduce the frequency and intensity of panic attacks. Understanding the differences between these two conditions is not about self-diagnosis, it is about self-empowerment. It is about having the knowledge to take your symptoms seriously, to communicate them clearly to your doctor, and to advocate for the care you need, whether that care is for your physical heart or for your mental and emotional well-being.